Hello, my name's Sue. I'm not a nurse, I'm Joshua's nana.
I'm Emma, I am a nurse, but I'd like to be treated as Joshua's parent rather than as a medical professional.
I'm not a nurse, but I deliver a high level medical care to my daughter Sophie Cooper at home.
I would like to ask for some training from a professional, not just for my daughter.
I'm trained as an adult nurse, not a paediatric nurse, and I'd like to ask that professionals treat me as Joshua's parent.
My wish moving forward with this campaign would be to have a better joined up approach with all medical professionals and families, ensuring that that care is delivered at home.
I first heard about the Not a Nurse campaign through the WellChild Facebook page. I thought it was an absolutely brilliant idea because I think there is a fundamental lack of understanding about the care needs that we are providing to our children at home.
So we've just had our second coffee morning for the Not a Nurse campaign here in Lincoln. It's been a fantastic morning with lots of cake and coffee. We've had some familiar faces and some new faces, which has been great to meet. There's been fantastic feedback in terms of gaps in services, and it'll be certainly something we'll be looking to move forward with and take forward as a parent-led campaign. And we've also had, for the first time with this session, professionals dropping in just to come and find out a bit more about the campaign and what they can do to help and support us.
I think it's great to get the word out there, and I think it's great for professionals to understand what these parents have to deal with.
Everybody knows my son's story, they know how early he was born, they know the health needs that he has, but I don't think people truly understand the level of healthcare needs that we are providing for him.
We do expect a lot of these families. We keep piling on the pressure and piling on the roles that they have to do. And I think sometimes we have to stop and actually reflect on what we're expecting families to do at home.
It would be amazing for me to be sitting here in 5 years' time and saying we have a much more joined up approach with professionals, community teams and families, with children with the complex care at the centre of all decision making. Emotional and psychological support for families, from feedback with families at coffee mornings, that's been a big thing that's come about. And certainly for me personally, one of the things I've been talking about with the WellChild nurses is a better model for care packages at home for family. You know, we all have various care packages, different postcodes, different agencies, and the consistent theme amongst all of our families is the care. It's a massive, massive gap in services. So for me in 5 years from now, I would love to be able to say, do you know what? We gathered this evidence, we recognised it, we've taken models to clinical commissioning groups, we've taken it further, and we're now achieving that.